Hello everyone, I'm Nina Sullivan.
And I'm Chloe Adamovich, and today we are going to be talking to you about the danger of opioids.
Opioids are a powerful pain medication that can lower a person's perceptions of pain. Opioids alter your brain by creating artificial endorphins.
Although this may sound good, after a surgery, opioids have many side effects such as dizziness, nausea, vomiting, addiction, and respiratory depression.
Opioid addiction is extremely dangerous. It occurs when your brain changes in certain ways so that you can develop a powerful urge to use the drug. This is called addiction.
Opioid addiction starts with you having control over the opioids you are taking for prescription use. Over time, your body is fully relying on the endorphins the opioids produce, relieving you of pain and making you feel good.
Your brain will start to rely on these endorphins and stop producing their own. Your body now relies on these opioids to function, and you will need more due to drug tolerance. This is how addiction starts.
If you or a loved one have an addiction to opioids, follow these 3 steps. 1. Commit to quitting. 2. Get help from your doctor. Find people who can help you find tools and the support you need to quit. And 3. Get the support, either from friends, family, addiction support groups, doctors, or therapists.
Thank you.
Today we are going to teach you about the do's and don'ts of getting your tan on.
First, we would like to inform you that sunlight contains ultraviolet radiation, which causes premature aging of the skin, wrinkles, cataracts, and skin cancer.
Make sure you always examine your body monthly because skin cancers detected early can almost always be cured if you know the ABCDEs of your skin, which include
asymmetry, which is one half of the mole doesn't match the other, border irregularity, color that is not uniform, diameter greater than 6 millimeters, and evolving size, shape, or color.
There are 3 main types of skin cancers you can get from sun exposure: basal and squamous cell cancer, melanoma cancer, and Merkel cell carcinoma.
Common forms of skin cancer are pale, wax-like pearly nodules, red, scaly, sharply outlined patches, sores that don't heal, and small mole-like growths.
To block out the sun, make sure you cover up by wearing thick clothing, use sunscreen of at least 30 SPF, wear a hat that protects the neck, ears, eyes, forehead, nose, and scalp, and wear UV absorbent shades, and limit your exposure. UV rays are most intense between 10 a.m. and 4 p.m., so make sure to follow the first 4 steps during this time period.
Everyone should always wear sunscreen and cover up their skin because the sun releases harmful UV rays all year round, even on cloudy days.
Anyone can get skin cancer despite of age, gender, or race. It is estimated that 1 in 5 Americans will develop skin cancer in their lifetime.
And remember, tanning beds are no better because they increase the risk of cancers and diseases such as fecal bacteria, the herpes virus, the papilloma virus, which causes warts, they're all able to survive on tanning beds.
No, go get your tan on, but be safe while doing it.
Mesothelioma is a very rare and aggressive form of cancer of the lungs, meaning that while few may be diagnosed with mesothelioma, those who do are hit hard and fast with no definite cure. Some kinds of mesothelioma include pleural, of the lungs, peritoneal, of the abdomen, pericardial, of the heart, and testicular.
This cancer is mainly caused by ingesting asbestos, a harmful substance where no amount of exposure is good. Asbestos is found in products including building materials and house building material.
Knowing the early signs of mesothelioma is massively important because the disease takes action with extreme speed.
Some symptoms include pain in the side of the chest or lower back, shortness of the breath, cough, fever, fatigue, weight loss, hoarseness, and swelling of the face and arms. While the symptoms don't appear sometimes decades later, life expectancy for diagnosis is poor, ranging from 5 to 10 years, so catching it early is important.
The treatments for this cancer vary with severity, but can include a combination of surgery, radiation, and extensive chemotherapy. In some cases where standard treatments do not work, mesothelioma patients may also be able to try experimental treatments through clinical trials, immunotherapy, or gene therapy. Some treatments may only relieve symptoms.
If you or a loved one believes they are suffering from mesothelioma, please see a specialist immediately, or call the helpline 424-283-1386 for more information.
Do you remember that truly iconic scene in everyone's favorite childhood movie, Mall Cop, when Paul Blart collapses due to his low blood sugar? Well, we sure do.
That's right, Ben. Today we are here to inform you of the dangers of hypoglycemia, or low blood sugar. What even is hypoglycemia?
Hypoglycemia occurs when your glucose level or blood sugar level drops too low.
Hold on. Isn't hypoglycemia the same thing as diabetes?
Not at all, really. Although sometimes people develop hypoglycemia because of their insulin, you can develop hypoglycemia without having diabetes. The causes are often unknown, as there are many factors to why somebody may develop this disorder.
Although we don't know the cause of Paul Blart's hypoglycemia, we do know that when he didn't eat for a long time, he would collapse.
Very true. When somebody with low blood sugar doesn't eat for a long period of time, the stored glycogen in their liver breaks down. When that energy source runs out, several things may happen.
Some of the symptoms of hypoglycemia are irregular heart rhythm, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, confusion, and even death in some severe cases.
As funny as Paul Blart is, hypoglycemia is a serious condition that everyone should be careful of.
Remember that even if people with diabetes are at a higher risk of developing it, anyone can develop hypoglycemia.
Have you ever felt sick after something you ate? Did you eat food that you think may have been undercooked or prepared incorrectly? You may have experienced a form of food poisoning.
Food poisoning is caused by eating food that has been contaminated by bacteria, toxins, or other harmful pathogens. The symptoms of food poisoning can start within hours or days after you eat the food. Symptoms include abdominal pain, diarrhea, fever, loss of appetite, nausea, vomiting, weakness, and fatigue.
To help treat food poisoning, you should let your stomach settle without eating or drinking for a few hours. Prevent food poisoning by cleaning, separating, cooking, and chilling your food.
Clean your food to prevent the spread of harmful bacteria. Separate your raw meat, vegetables, and other ingredients to prevent cross-contamination while preparing the meal. Raw meat should be kept off the same cutting board as vegetables.
Food should always be cooked at the right temperature in order for it to reach a temperature that kills the bacteria or toxins. This is the same for chilling food, as it should always be refrigerated or frozen at a temperature that keeps it fresh and long-lasting.
Following all of these precautions will help prevent the duplication of harmful bacteria amongst many foods. Luckily, food poisoning tends to go away after a few days. However, this isn't always the case, so it's important to still pay attention to your food and how it's prepared.
See that boy behind us? See what he's doing? Texting, that's completely normal. Notice the background, the tractor trailer coming for them? It's probably photoshopped anyways. Actually, 26% of car crashes in 2014 were caused by cell phone use behind the wheel.
Wow, that's more than I expected, but that would never happen to me.
Well, I hope not, but 1 in 4 car crashes involve texting and driving.
Oh, jeez.
It can wait. Sucking it up and listening to a song that may not be your favorite is worth more than your life.
Everyone thinks it can never happen to me. Even I did.
Spare yourself from texting your friend that you're on your way so you can experience important life events.
It can wait.
Hello, our names are Liam and Lincoln, and we are here to inform you about concussions. Concussions are formally known as a brain injury caused by a blow to the head or body. Concussions can be attained at any age and are very common in sports, especially ones of contact.
Our goal of this PSA is to inform you about the brutal and potentially life-lasting effects that concussions have on the brain.
Among the largest causes of concussions are motor vehicle accidents, falling, and sports-related injuries.
The cause of concussions is when the head is jolted, bumped, or hit by said cause.
Symptoms can be noticeable within moments after receiving the injury and can last anywhere from days to months depending on the severity.
Symptoms include headaches, nausea, vomiting, delayed responses, and more.
Treatments of concussions vary depending on specific cases, as not all concussions are on the same caliber of significance.
Treatments can include as little as rest and relaxation, or can be as serious as prescribed pills and therapy.
To prevent concussions, you should always be aware of your surroundings, wear helmets or protective gear while playing sports or games.
And remember to always follow the necessary precautions in order to keep your head safe.
With this knowledge, you too can help prevent the rise of brain injuries.
Hello, this is an informational video about how to remove, treat, and avoid a splinter.
The best way to treat an injury is to try and avoid it completely. This can be done by being cautious around broken pieces of glass and metal. Also, if there happens to be an old piece of wood from a deck, splinters can protrude from the piece of wood, so make sure you wear shoes or sandals to protect the bottom of your feet.
However, if struck by one of these little heathens, be sure that you are treating it quickly and properly because these have proven to be fatal.
Once splintered, make sure you take the necessary steps to ensure your safety. For small splinters, you can usually use sticky tape, hair wax, or let it fall out after a few days.
For large splinters, use tweezers with rubbing alcohol to avoid any infection. If the splinter is not sticking out, use a needle to try and expose it. Then use tweezers to remove it.
If the splinter happens to be too deep or is bleeding heavily, see a doctor to treat the wound.
This information will help you avoid infection or any other serious injury.
Hello everybody, Jameson Green here, to talk about the ever-growing issue of childhood obesity. Childhood obesity is an epidemic that is silently sweeping across our country as well as internationally. Through our youth, our country is made, and we are not taking the necessary precautions to keep our children of the future healthy. Some precautions we should be taking are educating the children and patients about healthy nutrition and encouraging children to be physically active before obesity controls their life and affects them physically and mentally. The fight against obesity in children should start before there is already a problem present. If we can promote a healthy atmosphere for children to grow up in consisting of healthy community activities, then we can stop obesity before it even happens. We have an obligation to our nation to help create healthy dietary patterns, create physical activity, and to promote a healthy lifestyle community. However, while it is important to encourage healthy behaviors on obese children, it is equally important to not stigmatize these children. Obese children may be dealing with depression over self-body image or other serious medical issues, such as diabetes, sleep apnea, heart disease, or a variety of other issues. This can all be prevented with an early plan to create healthy habits for children in all socioeconomic communities. Thank you.
Breast cancer is the most common type of cancer for a woman. In 2012, 1.7 million women were diagnosed with breast cancer. It is the fifth most common cause of death from cancer for women.
Breast cancer is the type of cancer in which cancer cells are in the breast. It is most common in women but can affect men. Breast cancer begins when cells in the breast begin to divide uncontrollably. These cells can then form into tumors. The cancer can spread to other parts of the body.
Breast cancer is organized into stages, stage 0 to stage 4. Each stage is more aggressive than the one before. Your survival rate is much higher if you catch your cancer in one of the earlier stages.
Cancer is diagnosed by a breast exam, mammogram, breast ultrasound, or a biopsy. A biopsy is the only way to confirm a diagnostic. All of these are performed by a doctor.
Breast cancer can be treated by surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, immunotherapy, and complementary and holistic medicine. The more aggressive your cancer is, the more aggressive your treatment needs to be.
Detecting breast cancer early increases your survival rate. You should go to your doctor's appointment and see if you notice any lumps in your breast. Detecting it early can save your life.
Hello, welcome to this informational video on food allergies. Food allergies is a silent killer of our generation. Nearly 4 to 6% of children in the US alone have some kind of food allergy. 90% of food allergies are egg, milk, peanuts, tree nuts, fish, shellfish, wheat, soy. I am allergic to 6 of the 8 on that list, and chocolate, one of the rarest food allergies. If I did not see a doctor when I was little to test for food allergies, then any of them could have been fatal without knowledge of my food allergies. To test for food allergies, you need to see a doctor and they give you a prick test. The prick test gives you trace amounts of certain foods to see if you would get hives to the food injected into your bloodstream. If the tests come out positive for any allergy, then you will be prescribed an epinephrine pen or EpiPen, which you inject yourself with in case of an allergic reaction. If you don't have knowledge of your food allergies and you think you may have an allergic reaction, these are the signs: vomiting, shortness of breath, wheezing, coughing, shock or circulatory collapse, tight hoarse throat, trouble swallowing, swelling of the tongue, weak pulse, pale or blue coloring of the skin, dizziness or feeling faint, hives, throat closing, or anaphylactic shock. To avoid an allergic reaction, avoid consuming or contact with the food you are allergic to. Children with food allergies are at a higher risk of having asthma or other food allergies. Although it is rare, children can grow out of their food allergies if they are lucky. If you are unsure of your food allergies, please talk to your doctor about getting tested. And if you encounter someone who has a food allergy, make sure to be cautious when giving them food.
Have you or a loved one ever experienced memory loss or were unable to form new memories? Making connections to past events is a vital process that is used in forming new events and memories every day. However, it is possible that you or your loved one has fallen victim to amnesia.
Amnesia is a fairly uncommon condition that is a form of memory loss due to brain damage to areas of the brain that are vital for memory processing. People with amnesia usually know who they are, but they may have trouble learning new information and forming new ideas.
There are many symptoms of amnesia, but two main types of amnesia are antegrade amnesia and retrograde amnesia. Antegrade amnesia is when a person has difficulty learning new information and recent memories are most likely to be lost, whereas in retrograde amnesia, a person has difficulty remembering past information and previously information, but ingrained memories may be spared.
A few other common symptoms include confusion, disorientation, false memories. In addition, risk factors of amnesia include previously having a brain injury, stroke, alcohol abuse, or seizures, because it may increase your chances of getting this condition.
Amnesia has no specific treatment, but there are ways to minimize the chance of getting it. For example, people should avoid excessive alcohol use, wear a helmet when biking, and seatbelt when driving. Treat any infection quickly so that it doesn't have a chance to spread to the brain, and seek immediate medical attention if there are any symptoms that suggest a stroke or brain inertia.
If need to be seen by a doctor, they will start by asking questions about your memory loss, as well as other symptoms you may have. They may also use cognitive and diagnostic tests to check the memory and potential brain damage. If you experience unexplained memory loss, head injury, confusion, or disorientation, call a doctor right away.
Hydration, we all need it.
Yes, what would we do without it?
Well, Jack, if we didn't get the right amount of liquid to keep our bodies hydrated, we wouldn't be able to complete day-to-day activities.
So, you mean if we get to 30 to 50 ounces of fluid per day into our bodies, we'd be dehydrated and not get enough energy to our cells?
Exactly. Now remember, there are many ways to become dehydrated. You can easily lose fluid when sweating or when sick.
How can I remember to stay hydrated throughout my day?
Keep a bottle with you so you can easily refill it throughout the day if necessary.
Wow, it's really that simple?
Yes.
Keep hydrated. Hello, ladies and gentlemen of the public. You may be wondering why we are standing here in front of a tick embedded into somebody's skin.
We are here to talk about Lyme disease and how it is spread, treated, and prevented.
My friend Brennan here is a survivor of the terrible disease that more than 200,000 people are faced with in the USA yearly.
It all started in 7th grade at a cross-country meet located at Shaw Farm in Sutton. While running through the woods, a black-legged tick found its way onto my body and latched onto my skin.
Brennan's new friend transmitted a bacteria called Borrelia burgdorferi into his blood. This spread through his body and caused immense pain to his joints and muscles.
Everyone thought I was joking when I said how much pain I was in. The stiffness and pain in my arm led me to believe I broke it, even though I didn't fall and hurt it. X-ray after X-ray, the doctors finally decided to do a test on me.
His test came back positive. My friend Brennan was diagnosed with Lyme disease. They put him on antibiotics to get rid of the awful bacteria.
What I ask all of you is to just be careful when in the woods. Check your whole body when you're exposed to a tick's habitat. They can latch on when you least expect it.
Being aware is the only way to prevent getting infected. In the end, after seeing my dear friend Brendan struggle with this disease, I have come to one conclusion.
Ticks suck. Catch it early, unlike me.